How to understand inflammatory markers on a gut test. Imagine trying to figure out if your gut is quietly sending signals of trouble. Inflammatory markers on a gut test are like little messengers that tell us what's happening inside your digestive system. They are substances measured in stool or blood that reveal if there's inflammation in your gut. Knowing what these markers mean can help you and your doctor understand whether your symptoms are caused by inflammation or something else. The most common marker tested in stool is calprotectin. This protein is released by white blood cells when there's inflammation in the intestines. If your calprotectin levels are low or normal, it usually means there's no significant inflammation. That suggests your symptoms might be due to irritable bowel syndrome or other non-inflammatory issues. But if calprotectin levels are high, it indicates inflammation, which could be caused by conditions like Crohn's disease or ulcerative colitis. The higher the calprotectin, the more severe the inflammation might be. This test is very specific to gut inflammation and can help avoid unnecessary procedures like colonoscopies when levels are normal. Another important marker is C-reactive protein, or CRP. This is a protein made by your liver that rises when your body has inflammation. Elevated CRP can point to inflammation somewhere in your body, including your gut. But because it's not specific to the intestines, doctors usually interpret it alongside other tests and your symptoms. White blood cell count is also checked in blood tests. An increase can mean inflammation or infection, but again, it's not specific to the gut. So these markers together give a clearer picture. If your calprotectin and CRP are normal, it's a good sign that your gut isn't inflamed. This points toward functional issues like irritable bowel syndrome rather than inflammatory bowel disease. But if calprotectin is high, your doctor might recommend further tests like a colonoscopy to look for conditions such as Crohn's disease or ulcerative colitis. Elevated CRP supports the presence of inflammation but needs to be considered with other results. Knowing your inflammatory marker levels can guide practical steps. If inflammation is present, eating anti-inflammatory foods like fatty fish rich in omega-3s, fruits, vegetables, and fermented foods with probiotics can help. Prebiotics, which feed good bacteria, may also support your gut's healing process. Avoiding irritants such as non-steroidal anti-inflammatory drugs, processed foods, and excess alcohol can reduce inflammation. For issues like leaky gut syndrome or chronic gut inflammation, targeted probiotics and specific dietary changes can help calm inflammation and promote healing. In the end, understanding these markers helps you and your healthcare provider make informed decisions about your diet, supplements, and treatments to support your gut health.